Thank you, Mr. Chairman, and thanks to all of you for being here today. Thank you for your testimonies. Dr. Perucci, I want to talk with you in particular, and I just was thinking as I was reading your testimony and listening to you earlier, my wife and I have two little boys at home. One of our little boys needed to spend some time in a NICU right after he was born. He wasn't breathing very well. He wasn't hearing well. And so he needed the NICU, and it turned out to be fine. He only had to be there for about half a day, but thank you for the extraordinary work that you do. And when I think about any child in this country, wherever she's from, whoever her parents are, whoever her mom is, whoever her dad, whatever, the fact that any child would not be able to get that kind of care that my son got and needed, that just seems like a travesty to me. And I know that wouldn't happen in your hospital. And so I just want to ask you, if a baby were born alive following an abortion procedure in a hospital where you worked, you would direct your NICU staff to provide medical care to that infant regardless, right? I mean, they wouldn't, that baby, she wouldn't be treated any differently.
Regardless of what the intent of the delivering personnel is, if there's a baby who's alive, my only goal, my medical promise to do no harm to care is to care, and we would be there.
And would you expect that most hospitals, I mean, probably all hospitals, I would hope, but certainly most hospitals would do the same? Would that be your expectation?
I would presume. We don't ask what the motives are of anyone who's delivering the baby. The call is a baby needs help. Okay.
Right, and then you respond. But I guess the thing that concerns me is most abortion procedures, we know statistically, don't happen in hospitals. They happen in freestanding abortion clinics. Am I right about that, by the way?
I believe so.
I found before I came to this job, I was Attorney General of my state, Attorney General of Missouri, and one of the things I found there was that a number of the freestanding clinics, abortion clinics in my state, were very reluctant to report any kind of complications that a woman may have experienced, including a potential live birth. And so here I think is what I'm getting at. Is it necessary to ensure the protection of any baby that is born alive? Is it necessary to require freestanding abortion clinics who are doing these medical procedures to provide medical care to that baby if she is born alive? I mean, do you think that is a reasonable thing to do, to make sure that the baby, has access to that?
I would, to be able to provide medical care that is consistent with the standard of care, whether it's the mom, the baby, someone in the waiting room, we need to have personnel who are trained to be consistent medical physicians, and the nursing staff and everyone in an emergency. Here's what you do. If you're in a regular outpatient clinic, they're supposed to know what to do in an emergency, and sometimes it's hit 911. But everyone is obligated to be able to stabilize. We all know, to the best of their ability, not everyone is ready for a critical care event. So you're supposed to be able to stabilize everyone involved, all of the people involved, until the next group of people get there. And I should state, I don't know what I don't know as far as where abortions are happening. I only know to come when I'm called.
Can I just ask you on that point about outpatient clinics? I think that's a really important point. Outpatient clinics are medical facilities, and your point just now that the personnel there, the doctors, the medical providers there, need to be trained or required to be trained to respond to a medical emergency. Can you just say more about that? I mean, what would happen in an outpatient clinic if there were a significant emergency that was a life-threatening emergency?
We've been called as the referral service in a transport region. We get calls from clinics, whether it's pediatrics or a baby, depending on the age of the person in jeopardy. That's what happens when you're the referral center, is we get calls from everywhere. We've even had calls from, please come to the mall. We've got somebody down, please come get the baby. You go where you're needed.
Yeah. Well, thank you very much. Thank you for the extraordinary work that you do. Thank you to all of you for your advocacy for women and for children. And thank you, Mr. Chairman, for holding this hearing. And I just want to say in conclusion, I think it is not only a noble and laudable goal, but it is consistent with who we are as a society to say that any child born in this country will receive medical care. And if their life is in danger, they will receive the care that they need, that she needs in order to survive. I just don't know how anybody could oppose that, Mr. Chairman. Thank you.